can look in the mirror, and if you are starting to develop that middle fat, that visceral fat, the belly fat, or the muffin top, then you can know without a doubt you are on your way to diabetes. You can know that.
Hey there, and welcome to Evolving Ageless. This is the enlightened woman's antidote to aging. We're working on reversing the clock here. So I am your host, Michelle Dreilich, and I am on a mission to change the way that women age. So each week, I'm joined by experts in their field that are sharing the latest and greatest research, what they're seeing in their clinics, their expertise, right? They're all here to help us live ageless. So I'm going to jump in right away because whenever this guest and I get together, we could talk forever. I am excited to welcome back to Evolving Ageless, Dr. Gina Pritchard. Hey, Gina.
Hi, so great to be here, Michelle.
Oh, I love it. So Gina, you've met her before. If you've missed that episode, I absolutely recommend you go back and listen. We talked all about cardiovascular disease in women and why it's so critical for women to pay attention to the signs of heart disease, early warnings for heart attack and stroke, and how they're so different for men. And that's really what the medical establishment is looking for. So today, we're going to turn our sights on diabetes. But first, I want to tell you a little bit about Gina, okay? She is one of the nation's leading specialists in the area of cardiovascular health, diabetes health and prevention, dementia, heart attacks, I've mentioned, and stroke. So this is her wheelhouse. She deals with this day in and day out. But because all of those things, as you optimized all the cardiovascular and what we call metabolic side of health, she is actually a health optimization expert as well. So she has quite a few athletes that she brings to kind of up level their health, taking it even to the next level and the next level above where they are. So she really refines and fine tunes their health. So she's also the clinical director of the Baldonine Method, which is a cardiovascular, metabolic, and dementia program. But also she has her own practice, and that's called the Prevent Clinic. And she has offices in Texas and New York, but is also completely virtual. And she's able to bring all of her expertise in cardiology and diabetes and dementia and health optimization right online and into anyone's living room. So that's what I love about it. All right, so today the topic is diabetes. I'm sure this is your wheelhouse. You talk about it all the time, but I think what I loved what you had said when we talked before was you're seeing more and more that people, women especially, who you wouldn't even think fit the criteria, once you dive in and get into their labs, you're noticing early or even moderately latent signs of diabetes. So let's talk about that.
Yes, absolutely. So I hope that no one will switch channels right now or go to a different podcast because you think diabetes doesn't relate to you. Because traditionally, we've thought two things, and these are myths. We've thought, number one, unless you're overweight, sedentary, elderly, living an unhealthy lifestyle, diabetes isn't going to happen to you or isn't going to happen to me. And then we've also thought that it was a black and white issue. You have diabetes or you don't have diabetes. You get blood work on your annual checkup once a year to see if you have diabetes. And if your blood sugar is under 100, you're good for another year. And those two things are absolutely myths. And when we practice like that, I practiced like that for many years, not suspecting diabetes in male or female, anyone who was thin and athletic, and also not suspecting diabetes if the blood sugar was below 100, checked once a year. And so my eyes have been opened in more recent years, to, as have many others, to the fact that there are individuals who are, as you mentioned, athletic, perhaps bicycling or swimming every day, miles and miles, wanting to improve their performance, and they have diabetes, or they have prediabetes, insulin resistance, or we'll talk about exactly what those terms mean in just a minute. But so if it can happen to them, it can happen certainly to any individual who is leading an unhealthy lifestyle or who is anywhere between, maybe exercising on a moderate basis and eating a fairly healthy diet, and you think you're pretty good because you don't smoke and you're active. So the bottom line is you don't know unless you really look at the right tests. And we'll talk about that in a minute. But I'd like to talk about what is insulin resistance and what is prediabetes, and at what age should you start being tested for it, and at what age should you start thinking about it. So prediabetes and insulin resistance, those terms are used somewhat interchangeably, but it means you're headed for diabetes, basically. So when insulin and glucose in the body are working absolutely properly, optimally, you drink a Coke, for example. I hope no one does that's listening to this podcast, but let's just use that as an example. You have a sugary drink, and your pancreas is responsible to put out insulin in response to this elevated blood sugar or glucose load in response to that, what you've just ingested. And the same thing happens if you eat an apple. It's just that the pancreas doesn't struggle quite as much because it doesn't have to work quite as hard. So the pancreas puts out insulin to moderate this glucose load. And over time, the unhealthy person, for example, that is drinking Coke all the time or eating pastries, etc., the pancreas just gives out. But also the cells in the body start to become deaf to insulin. And so my good friend David Wright compares it to losing your hearing or becoming a little bit more harder, in unable to hear as we get older, because we've listened to concerts and high volume music when we were young. And so we're starting to become deaf to sound because we've been exposed to high volumes of noise early in life or throughout our life. And that's what our cells are doing. The cells become deaf, so to speak, to the impact that insulin is going to make. That's why we've called it insulin resistance. The cells are resistant to insulin. And we can talk all day about why that's a terrible problem. So that is a pre-diabetic state. Whether you're insulin resistant or your insulin glucose metabolism is just not pristine, you are inching your way towards diabetes. So how can you know? Anything you want to elaborate on that, Michelle?
I
with
love
your
this
background in
topic.
nutrition?
Yes. I can't sit still. So I think, especially for this audience, so often women are looking to optimize the way they look on the outside, right? Like we eat healthy, we exercise, and very often around 45, things start to slow down, right? We've all recognized that. But there are women, even younger women, that I've worked with that just can't lose weight, right? And no matter, and the first step is you think, are they being completely truthful, right? On what they're eating, what their habits are. But I know women that say, like, I work out an hour and a half a day, and I eat salads for lunch and an egg for breakfast. And you think, God, how could this be true? How could this be happening? And sure enough, once we start running some labs, right, we see that they're insulin resistant. So the idea that I always like to bring awareness, because I know people, they don't like to hear the word diabetes. It scares them. But I will tell you, if you are insulin resistant in any way, it can have a drastic effect on your ability to lose weight.
Absolutely.
I don't know if you want to talk about that.
I do. It's such an important point. And I'm so glad you brought it up before we moved on to testing or any other aspect of this, because when you hear these people I at first thought they were making kind of grandiose claims to say, you can't lose weight, it's not your fault. I'm like, it's kind of like you. Are they really telling the truth?
Of course it's
now I know. Yeah, right. Now I know that indeed one of the biggest factors in weight loss resistance, what you've just described, you're doing everything right, and that middle fat or the muffin top still won't come off. Or maybe the pounds or the inches just continue to slowly increase and you eat less and less. So the problem, first thing you should think of is, wow, I should find out if I'm insulin resistant, because insulin, and particularly high levels of insulin, does one really great thing and it does four really bad things. And so the one really great thing that insulin does, and why we must have it, is it saves your life. Because if you drank a sugary drink like I just spoke about, the blood sugar would just keep soaring until you went into a diabetic coma, or the blood sugar reached 300, 500, 1,000, if you didn't have insulin to moderate that problem, and you would die.
It's just like drinking alcohol, right? I mean, if you drink alcohol, think about it. You get to a point where there's so much alcohol content in your blood that you can't function. And we think, oh, that's terrible, that's bad. But sugar is the exact same way, except our body has a much better mechanism in place to handle that sugar, right? So, which is insulin.
Exactly. And
That's
so if you
cool.
think, well, I won't have a problem, my insulin's good, or my pancreas is good because I'm eating healthy and exercising, there are many other factors that could contribute to it. Lack of sleep, stress, genetic factors. You could have a genetic predisposition for diabetes and definitely have this problem even if you're leading the most pristine life. So again, everyone needs to be checked. But we'll talk about those aspects on another day, like what could lead you to have diabetes even when you're living clean, so to speak.
Right. But hopefully this is a good wake up if you find yourself in that resistant place, because I think what most doctors will think if you come in and say, I'm working out, I'm eating super healthy, I don't drink, I don't smoke, everything's great, and I cannot lose weight. The first thing they will do is run thyroid, right? But the missing piece, and that it could be thyroid. It's not that it's not, right? But that's usually where practitioners go, well, let's look at your thyroid and see, because thyroid can have an impact on that.
Right.
However, 9 times out of 10, it's almost not thyroid, and it's glucose related or insulin related. So,
yes.
All right. So, are there ways that we could get an idea, even without lab tests? Like, what would some signs be that we're insulin resistant or have pre-diabetes?
Yes, absolutely. Let me just mention the 4 bad things that insulin does.
Oh,
and then
gosh,
let's talk about those.
Yeah.
We've said the one thing saves your life, but it's a fat fertilizer, insulin. So what you've just described, that's why you're weight loss resistant, because it's just making for a perfect scenario inside your body to really grow and hold on to fat. So think about that every time you wonder, if you're, first of all, leading the lifestyle you should, and second of all, if you have insulin resistance or pre-diabetes or even diabetes and don't know it. Fat fertilizer, second of all, it is one of the biggest contributors to what we call a fire starter or inflammation in the body. So your body is constantly in this pro-inflammatory state, which leads to chronic disease for sure. So if you want to reverse the clock, if you want to live as long as you possibly can, vibrant to the last breath, you have to know where you stand in terms of insulin resistance, pre-diabetes, and diabetes, because this crazy high and low insulin or persistently high levels of insulin leading to insulin resistant is going to just keep your body, whether you know it or not, whether you feel it or not, in a highly inflamed state. Bad for many reasons. Thirdly, it's a plaque promoter. So most of us think about vascular disease as having plaque in the wall of the arteries, and this is indeed true. And insulin just promotes that like crazy. So you don't want this problem, because you rest assured you're developing vascular disease, which could lead to heart attack and stroke. And if you do have plaque or even a small amount of it, the worst case scenario is for you to form little clots in the area where the plaque is, which is a very common reason for heart attack and stroke. And that's the 4th thing that insulin does, is it's a clot promoter. So you tend to overclot. So if you're someone who's had even venous thrombosis or any suggestion of clots in the past, or your doctor has said you're in a hypercoagulable state or something along those lines, think of this problem and know that you need to be tested.
Wow. And so I'm going to do a major throwback here, but like in the 80s, when everything was fat-free this and fat-free that, and the Snackwell cookies,
I
right? And I
remember.
remember I'd start my morning with a fat-free bagel and fat-free cream cheese and fat-free jelly on it, right? It was like a sugar bomb was my breakfast. And that we've always thought, and we were taught by the medical establishment in the 80s, that fat was the enemy, and fat is what caused arterial plaque, right? Because we connected it to cholesterol, and there is some connection there, but that's not it. Insulin and glucose in the bloodstream is by far more dangerous for your arterial wall than some fat.
Absolutely.
Crazy.
Absolutely. Yeah, it is crazy. I remember the same thing. I was recommending snack wells in the hospital, discharging patients. Like looking back, it just makes me sick. That was
I
the
just
absolute
I
worst
just hit
thing.
my mic. It was like, yes, I would eat a sleeve of them as dessert, right?
Yeah,
What was
right.
that? It was probably like 90 carbs I was eating.
Yes,
Of
exactly.
pure sugar, right? They weren't
Right.
even slowed down with any protein or fat. So
No.
you know, that myth, and I assume most of our audience knows that the fat-free myth, if there's anything fat-free in your pantry or in your refrigerator, swap it out. Do yourself a favor, swap it out for the real thing and just eat a little bit less of it. You know, it's
Yes.
okay. All
Yes,
right.
those good healthy fats are essential for sure.
I love it. All right, so we were going to talk about what are signs that we could
Yes.
be insulin resistant or have pre-diabetes
Yes.
if we don't have lab testing right now. Like, what
Okay.
would we look for?
Yeah, and there are several that are very good and very easy to do. One is you can look in the mirror, and if you are starting to develop that middle fat, that visceral fat, the belly fat, or the muffin top, then you can know without a doubt you are on your way to diabetes. You can know that. But you can
Shocking.
also measure the waist, even if you're like not sure, maybe the pants are a little tighter, you're not sure if that's really the problem. Measure. And there are strong scientific evidence behind the cut points of 35 inches for a waist for women. You want your waist to be less than 35 inches and men less than 40 inches. Now, there are some variances and nuances for ethnicities, which we can, send a PDF or give those details as needed. But in general, less than 35 inches for a woman, less than 40 inches for a man, to ensure, or at least be your first clue that you're okay and that you don't have insulin resistance or prediabetes. It's not 100%, but at least if you are above 35 inches as a female, then no, you need to get more testing because it's highly likely that you are either insulin resistant or well on your way.
And along those lines, though, I would add, if you're just recently in menopause, like having passed menopause, you're postmenopausal, or maybe you're within like that perimenopausal place and you start to see the muffin top, don't wait till you're 35 inches because
Yes.
that's the sign, right? And we can see it. Maybe because I live in Florida, it's more noticeable, but we've all seen it. If you've been to Disney, when you get a cross section of America and you start to see women over 50, we get a more stocky middle,
Mm-hmm.
that, and we've always just assumed that that's related to the fact that we're losing hormones. And while that plays a role there, insulin also has a huge role there, right? So if you start to notice weight gain around the middle under any circumstances, that's a good sign that you've got too much insulin too much throughout the day.
Yes,
Good.
absolutely.
I love it.
So
What
the
else?
third thing, if you've ever had just blood work that included your good old-fashioned lipid profile, meaning total cholesterol, LDL, the bad cholesterol, HDL, the good cholesterol, and triglycerides. If you just have those four results, in fact, you really only need two of those, but a lipid profile has all four. And if you can look at your triglycerides, write that number down, look at your HDL and write that number down and do division. You want your triglyceride HDL ratio, triglycerides over HDL, to be less than 3.5 as a Caucasian, less than 3.0 as a Hispanic, and less than 2.0 as an African American or of Black ethnicity. So, and again, we can talk about more ethnicities on another show, but simple blood work that is done on the annual exam that probably most of the listeners have had performed, that is an absolute yes. If it's above those cut points, you've got insulin resistance. So now you need more testing and you need to do something. You need to see somebody that can give you great advice, because that's not kind of like the weight around the middle, could be, couldn't be, that kind of thing. Not sure. You can look at body composition. That might help you, like how much fat are you actually carrying. But this one is a definite yes. You can say, I've got the diagnosis. If it's
That's
high
amazing.
triglycerides, low HDL. Yeah, even if you don't do the math, high triglycerides, low HDL, if that's something your doctor's told you every time you go in, wow, we've got to get those triglycerides down, and that HDL needs to be higher, then you've got insulin resistance.
I mean, and that's a really narrow window, because I mean, most people, you have an HDL of maybe women 30 to 40, somewhere in there, right? And so if you're African American, that means your triglycerides have to be between 60 and 80, which is a good, healthy space for triglycerides, but usually rare when you're looking at laboratory testing for people. So
Yeah.
and what's interesting about that is, I love the point that you make, that that's on, I mean, every doctor in the world runs a lipid panel. And what's interesting about it is most of them are looking at that LDL number and total cholesterol, and we don't care about that. We're looking at the triglycerides to HDL ratio, which they're spending less time looking at HDL probably, and just saying, oh, you need to exercise more. That's fantastic. So, okay, so now we've got kind of this idea around it. It can happen to anybody. It doesn't necessarily mean that you're drinking, big gulps all day long of Coke.
Right.
It could happen to people that are eating really healthy. What I have found is when people yo-yo diet a lot, it kind of sets the stage for insulin resistance when they're not in the phase of yo-yo dieting, right? And then what about skin tags? Tell us about that one, because I think that's a sign that I think a lot of people aren't aware of.
Yes, absolutely they aren't. So whenever you have a skin tag, you definitely want to think about insulin resistance for sure. Isn't that crazy? Like falls into one of those red flag categories that like we don't really understand why, but we know it's associated.
Yeah, so it's not unusual as we age to start to notice a little fold of skin that starts off a little itchy and starts off to be this little mound, but that they develop as a result of insulin resistance and prediabetes. And when you've got lots of them, that's usually a diabetic. Very often, I think diabetics have several skin tags and things like that too.
Yeah, absolutely. So if you're noticing any of these things and just thinking, well, it's my age, that's a dangerous thought. It's not your age. We're here to say we're going to reverse the clock. So don't normalize it. We now know we can investigate it and give you some great recommendations. The other thing that I think is a powerful way to understand where you are is if you have access to a blood sugar, finger stick blood sugar machine at home, then use it, even if you're not a diabetic. So many people, and I recommend, just like having a blood pressure cuff in the home, thermometer in the home, have a blood sugar machine in the home. One of those little finger stick machines, you can get it at any pharmacy or even a lot of grocery stores now for a pretty low price. And just check your fasting blood sugar, and then check your blood sugars 1 hour and 2 hours after a meal, because the body can maintain a normal fasting blood sugar for many years. So earlier in the show, when I said that's all we would look at from year to year is a fasting blood sugar, people were walking their way, their health, moving towards diabetes every year, maintaining a fasting blood sugar well below 100. That's the last sign, is an elevated fasting blood sugar. So you want to know, what does your blood sugar look like after you eat something, even if it's a healthy meal, and certainly if it involves a high glucose load. So that's another test you can do at home. You want the 1 hour to be below 125 an hour after a meal, and you want the 2 hour to be below 120 2 hours after a meal. And of course, you're really trying to mimic that that yucky 2-hour glucose tolerance test that many of us had when we were pregnant. That's really what you're trying to mimic at home. You may have gone to the lab and had that test done where you drank the sugary drink and then they checked your blood sugar at 1 hour and 2 hour. But if you gather that information at home on your normal diet, it's still helpful information when you go to see your doctor.
Absolutely. And so if someone suspects they might be insulin resistant and they're working with their doctor, and it's before the doctors run some tests, what kinds of things would they ask for to be considered?
Yes. So definitely, if you haven't had a lipid panel like we just described, you need that. And you can do the math or ask him to do the math or ask the lab to run. They'll actually calculate it for you and print it out on your lab work, that triglyceride HDL ratio. But lipid panel, number one. Number two, you'll get a fasting blood sugar on your annual exam, and oftentimes a hemoglobin A1C, which is a 3-month average of blood sugar. And that's good if it's positive. If it's starting to inch upward from year to year, then it's certainly helpful finding. But it's just like the fasting blood sugar. Your hemoglobin A1C can be normal for a long time, maybe even well after you have diabetes. The body has this capability to maintain an average blood sugar that's pretty good, but that doesn't mean your insulin isn't spiking way out of control. You're having highs and lows. So your average looks pretty good. So don't rely on the hemoglobin A1C, which is also a part of the annual exam now, usually, which is better than nothing. If it's positive, then you've got it. If it's negative, dig deeper. The other thing that you want to ask him or her for, your doctor, is this 2-hour glucose tolerance test. And, insurance typically won't pay for it unless you're diabetic. Now, that's getting better as this is becoming more and more understood, but it's an inexpensive test. So, I highly recommend that you get that test as well. Let's see, I was going to say something else about the lipid panel. Oh, you also want to look at inflammation, because as we said, this insulin problem, let's say you've got kind of a chronically elevated C-reactive protein. That's commonly HS, highly sensitive C-reactive protein, is a commonly performed lab test on the annual exam now. So if you've had that, and again, it's elevated, it's creeping upward. A lot of things can cause an elevated C-reactive protein, but one biggie, if you will, is insulin resistance or prediabetes. So suspect this problem if you have any inflammatory markers that are high. There's a whole inflammatory panel you can get, but that's a great place to start.
That is a great summary of the labs that you would want to have run, what they mean. I know that glucose tolerance test was icky, nasty, drinking that orange stuff and waiting in a lab. But it's probably the most accurate. They call it a functional assessment, right? Because they're actually measuring your body doing the work that it's supposed to do to clean up that glucose. So it is the way I understand it, just a fantastic test. Let's follow that insulin talk a little bit though too, because we talk a lot about inflammation and aging and how being inflamed in a chronic state is what causes us to age, right? It's part of that breaking down muscle, breaking down collagen, all kinds of things happen when your body's inflamed, right? So I don't know if you want to add to that, but I also want to plant this seed, the type 3 diabetes idea of what diabetes, pre-diabetes, insulin resistant, what that level of smoldering inflammation means. Because I think we do a decent job in medicine at managing diabetes. We've got medications, right? We've got supplements, we've got ways of eating. It's the disease in and of itself, we do a decent job of managing it, but that inflammation rarely goes away.
That's exactly right. So you don't want diabetes if you can reverse it now. If you can turn the car around, for example, and not move towards diabetes, because it does lead to dementia. It's one of the top reasons that early onset dementia and late onset dementia is a problem, because of this inflammation that's occurring and those 4 bad things we talked about that insulin does. So we have very tiny capillaries and tiny blood vessels all throughout the body, but most importantly to the brain and the vital organs. And so they're the first to be affected by this problem of insulin resistance. So those individuals that we talked about earlier, that their fasting blood sugar is fine for years, it's under 100, but they have this underlying insulin resistance that hasn't been diagnosed. Those small, tiny blood vessels are being just wrecked on the inside from inflammation all of those years. And over time, they start to slowly just occlude, meaning block off. And so blood flow is just knocked out of larger and larger and larger pieces of the brain. So your brain can't function properly. And that can happen to any organ. That's happening to your kidneys. It's happening to your heart. It's happening to your intestines, to your lungs. You aren't getting adequate blood flow, but it's a slow process. And you look pretty good in the mirror and you feel fine until you don't, if you don't look.
That is so powerful. And so let's also talk about, I know one of the things that's always kind of top of mind for women, especially given some of the statistics that we see out there, but you know, having a chronic level of inflammation is really one of the, it's almost like sowing seeds or planting seeds for cancer, right? We talk about that a lot too. And so I don't know if you want to expound on that or.
Yes. So it's one of those diseases that we lump in there in this chronic diseases, which doesn't sound too scary. It's like, oh, if you live long enough, you'll get a chronic disease. My mom had it. My grandma had it. That is not true. That's the whole purpose of this podcast that you're doing, is we're trying to dispel these myths that you don't have to go down the path of your mother or your grandmother. You don't have to go down the path of having a horrible last 10 years of your life. The majority of Americans have a horrible last, actually 11 years based on the science of declining health, poor quality of life, but it doesn't have to be that way. It doesn't have to involve cancer and heart attack and stroke and dementia and disability and kidney failure and blindness and all of these things. We can still be out there vibrantly involved in life, continuing to reach our goals, being there for our family, enjoying life to the last breath, if we take note of these things right now. And really, they're relatively simple. And maybe it sounds like, oh my goodness, you know, what am I going to do about it if I do? There's a lot of things that you could start doing today.
So let's talk about that. So other than, so the first thing obviously is get checked, right?
Right.
Go get some labs done, understand that triglyceride to HDL ratio, and then use that to look at your hemoglobin A1C and make sense whether that is accurate or reflecting your situation over the last 3 months. What about fasting insulin? Do you recommend those too?
I'm so glad you brought that up. I meant to mention it earlier. And so it's you know, all of us in this preventive world are just sort of debate that. It's not at all wrong to get an insulin level, for sure. So a lot of doctors will get fasting insulin with that fasting blood sugar. We'll get the insulin with the 1 hour and the 2 hour, and we'll monitor insulin in a variety of ways. And that absolutely is not wrong. My caution would be, it can be misleading because your pancreas is trying so hard to do its job for so many years that it's going to trick you sometimes, because it is putting out adequate insulin until it just can't do it anymore. So you can't rely on that only, but it can give you some, you and your doctor with your conversation together can give you some clues. But I would say to rely on that is not complete.
So when we talk about all of these different labs that are conventionally run to assess diabetes, what's interesting is the answer for almost all of them, right? When we look about when we talk about hemoglobin A1C, we talk about glucose, we talk about fasting insulin, the answer is always, it's not confirmatory, it's not confirmatory, it's not confirmatory. And then the one thing that you did say was triglyceride to HDL ratio, bingo. So let's all, especially because I think everyone gets a lipid panel. It is standard around the world. So what a great window and a little sneaky trick that you have up your sleeve to know if there's something going on. So number one, go back and look at your old lipid test. pull your triglyceride to HDL ratio. And what was it again? 3.5 for Caucasians,
That's
under
right.
3.5, under 3.0 for Latino,
Hispanics, yeah, Latino.
and under 2.5.
2.5. I'm
Wow.
sorry, 2.0.
2.0 for
2.0.
African Americans.
Right. We know there's a higher incidence in the African American and Black community. And unfortunately, that's a genetic predisposition and many other factors. But yeah, the research shows that triglyceride HDL ratio needs to be under 2.0.
Great. Okay, so those are your targets and as it relates to lab testing. So what's the next thing that we can do to make sure that this isn't something that is affecting us?
Right. So the next thing that you can do, of course, besides getting a look at those blood sugars after you eat something and getting inflammation testing done, is to look at your lifestyle. If you're the person I described at the beginning that is exercising every day, very active, eating very clean, not smoking, sleeping great, you're handling all of the stress in life right now very well. Many of us right now really need to take a look at our stress and our sleep, particularly in 2020, like never before, because we have these new stressors we didn't have before, and lack of control and so many changes. So that's look at all of those things to see if you can improve any of those areas first, because absolutely we have to start with the basics. And one of the biggies is, and you can speak to this far better than I, but is to look and see if you've allowed too many carbs to sneak into your diet, or too many processed foods, particularly in this time when our life is not like it was in 2019.
Right.
So
They're calling it the COVID-19 pounds, right?
yes, right, right.
So, yeah, absolutely. It's kind of working its way into Americans' homes, that's for sure. So,
Yes,
okay, so lifestyle. So
right,
looking at the food choices that we're making, are we sleeping? Are we managing our stress? How about movement? Let's talk about that.
right. Yes, movement, absolutely. So if nothing else, get out there and walk 20 minutes a day briskly, or on your treadmill if you can't get outside, or anything you can do in the home to get your heart rate up for 20 minutes. Some people really don't have a great place to even go out and walk during this time, or they are not wanting to. Whatever you can do. Leg raises. You can, if you have a stepper at home, you can get some heavy gallons of water or whatever and do some arm raises. Move, move, move. You just have got to move every day. That is your biggest ammunition, if you will, against diabetes. It's your biggest bang for the buck, is to move. And in that movement, you will be developing muscle, which is, of course, one of the major concepts of ageless. We have to get more muscle and less fat on our bodies. And so you've got to move to do that.
I love it. I love it. So Dr. Gina is featured in the Ageless Transformations program. So if you go to agelesslx.com, you can learn all about the Ageless Transformations program, where she teaches this little bit of info. What we're doing today is like a snippet of everything that she talks about within the program, but is just an amazing friend and an amazing resource. I know that firsthand, this is the kind of care that all of Dr. Gina's patients count on, because this nice, easy style, encouraging. That's what I love about you. You're so encouraging. You know how to flip it around and make it positive. And you're so incredibly knowledgeable about all of the diseases and the state of health that can lead us to a long, healthy, vibrant lifestyle to our last breath, or just making slight changes, right? That we talk about on Evolving Ageless. We're just evolving. It's not a radical overhaul overnight, but just changing one thing at a time. So if today's talk resonated with you, to do one small thing, whether it's grab your old lipid panel, go take a 20-minute walk, measure your waist, whatever it is, it's taking a step toward recognizing that you actually control the way you age. It's not happening to you. You're a part of it. And so what while it can be discouraging to think that maybe you've lost a few years not doing the things you could be doing, I think it's even more encouraging to know that you own it and you can
Yeah.
flip it around. I love your message.
Oh, thank you so much. Thank you for your words, and thank you for allowing me to be here today. And thank you for continuing to bring life improving and life saving messages to these podcasts. You're doing a great job. Wonderful
Oh,
content every time.
thank you, Dr. Gina. You're amazing. So, if you want to learn more about Dr. Gina and her practice, how to get in touch with her, how to benefit from her expertise, there is a link. If you go to evolvingageless.com, go right to this podcast, and in our show
Mhm.
notes are links to Dr. Gina and her Prevent Clinic in virtual clinic. So, what a wonderful opportunity for folks. And it's not too late to check out Ageless Transformations. It is literally a health reset. If you find yourself struggling with all of these things, that is what you can do. Check out Ageless Transformations and learn more about how each one of those topics we talked about, nutrition, exercise, stress, sleep, movement, how they all, or even relationships, how they all
Mhm.
play a role in our long-term health. So, Dr. Gina, thank you so much for joining me today. I know we'll be back with some other great, exciting, every time you're on, there's such amazing wisdom being
Oh,
dropped. So thank you so much.
oh, my pleasure. Thank you, Michelle.
All right. So I will be here same time as always next week with a new guest and new radical information that's going to make you aware of ways that you can change your life so that you can live ageless. So I will see you then. For now, take care. Bye now.